You all here. Today we're going to talk about a topic that sits at the heart of the regenerative and modern longevity health, stem cells and their power to transform how we age, thrive and heal. We're going to talk to Dr. Joy Kong, expert specialist in stem cells. So if you have any questions about stem cells, about regenerative medicine, longevity, how to stay young and healthy, this is the time, this is the place. So write your questions in the comment or the question bubble, and I'm going to invite Dr. Joy Kong in a second. Hello. Hi, Dr.
Hello,
Kong.
hi, Dr. Bahar. So nice to meet you.
And you, great to have you here today.
Yes. Really happy to join.
Thank you for accepting the invitation, and it's great to have you here. There's so many questions and curiosity about stem cells, and who better than you?
Yes, definitely. Happy to answer any questions. It's very
So
exciting. Exciting
let's
time
dive
in
in
human
and
history.
start the questions. I received some questions about them for listeners and audience here. If you just tell us what are stem cells and why they're such a big deal in regenerative medicine.
Yeah, I think what's really cool about stem cell therapy, really, one reason I'm so inspired is because this is the first time in human history that we're actually borrowing intelligence that's created probably somewhere else. We don't know how it's created, right? We don't know where everything started. But what we know is that between humans, we can create life somehow. I think we're just a receptacle. We're holding the life. As a mother, you are not creating it. You are a vesicle, you're a vessel to hold this life form, which is fertilized egg. And that is the very first stem cell for each individual. So, of course, one begets another, right? We come down generations, and that's how we have this incredible human species. But that one stem cell has the capability to form an entire organism. Somehow that one cell knows how to multiply and how to divide and migrate and then further gaining functions. And so you have all these diverse population of cells, each knowing where to go, what to do. Um, Along the pathway of becoming the final individual with all these organs, right? Heart, liver, with all these working cells, are these pathways that the cells keep gaining function and keep losing capacity. So if you're full of capabilities, then you don't really have specialization as much. So, but as you specialize toward the end organ cell, you are still a stem cell until you become a heart cell, liver cell, muscle, bone. So anywhere along the line is a stem cell. So when people talk about stem cell, I mean, it's not one population, it's probably thousands and thousands of different kinds of cells. But anywhere along the line, we can intercept and grab the cell and help it or put in the body and allowing it to go down its pathway or send signals. And that's one thing we know the cells are really good at doing, which is to send signals, is to coordinate activities, especially the mesenchymal stem cells. And people are hearing a lot about the mesenchymal stem cells, and they probably don't um, know that we're not counting on these cells to become a tissue cell so much, although it does happen, not infrequently. But that's not the major function that we're counting on. We're using these cells that are actually along all your blood vessels. Anywhere you have blood vessels, you will have these mesenchymal stem cells. They're all outside of the blood vessels, holding onto the vessel wall, ready to go anywhere is needed. But it's keeping tabs um, of the neighborhood. So where it's sitting, right, the blood vessel, it will have tentacles to reach out to local stem cells and other cells and have direct communications. So it's sensing what's going on in the blood and it's sensing what's going on in the neighborhood. If the neighborhood needs its help, it's going to secrete different factors and different signals. It can send signals directly into the blood or send signals in the neighborhood So what it sends in the blood can invoke the immune system, can invoke your systemic response. But sometimes another location may have this screaming signal because it's inflamed or there's an injury, and then these cells can actually squeeze themselves into the blood vessels and swim upstream to find where the problem is at, and then squeeze themselves out, and now they can do all the things that they do, which is sending signals in the blood and connecting with the cells in the neighborhood and talking to them. So what we're doing right now is to harness these cells. I think we're still at the beginning of stem cell therapy. This is a really exciting time that us humans discovered these cells. So we're just beginning to utilize them. In the future, of course, you already heard of, everyone may have heard about how the Japanese scientists were able to get one cell from the skin, right? Take skin cell and then basically transfect them with viral vectors, certain signals, certain factors, basically certain molecules that can trigger a response in the cell and revert them back to the embryonic state. So almost the first group of cells. That one sounds amazing. It sounds like, oh, that's a holy grail. Now we can revert them back to the embryonic state so we can become anything we want. But we're having trouble controlling them. So just because they are in the original state doesn't mean that it's fully healthy as far as the health of the cell, because you're using viral vectors to change it. But also, all the genetic factors, we don't know if these cells are actually, are devoid of the genetic changes that has been occurring in this adult cell. So now the cells can go crazy and divide into anything in the body and forming a disorganized ball of tissue. So that's one problem. So right now, the best we have is using mesenchymal stem cells, this overall signal to the body to invoke the body's ability to heal. But in the future, we probably can get different cell lineages if we know somebody has, especially the brain is one of the hardest things to repair. Of course, we have different organs as well, right? Heart, pancreas, etc. We can get specific cell type and put it in that vicinity and allow those cells to become the local, right, the heart or pancreas cells. So we can do that in the future. We're not that advanced yet, but doesn't mean that people are not seeing incredible things left and right. That's why the whole field has exploded. I just trained 40 providers this weekend. People are absolutely excited, but the word is getting out and people are looking for places to learn. A lot of doctors, they want to get into the field, but they don't know what to do. They don't know enough of the science or the techniques and just understanding the whole ramification. So it's really wonderful to see people really want to, search, that they're seeking excellence, right? So so the field is expanding rapidly, even though the system is not supportive. The system, just for example, you can run an ad on Google or Instagram or Facebook talking about, I do stem cells. Our clinic provides stem cell therapy. They're going to shut it down. They're just going to say reject. We don't we don't support unapproved or unproven therapy. Never mind, there are thousands and thousands of research articles, studies from all around the world, in no unequivocal terms of how these therapies are effective in controlled, sometimes large human studies of how much people are getting relief. Because I go through studies after studies. It shows you that there's a huge response rate, right? Double-blind controlled study, a huge response rate, way better than what you can get in drug studies. So the evidence is there, not for every disease, not for everything under the sun. Some are not studied yet, but there are a lot of resounding evidence of efficacy. So anyhow, that's a kind of quick overview.
Yeah, it's great. I mean, it's as you mentioned, it's early days and it takes a while. But there are, of course, a lot of hypes and confusion, I think, around stem cells. And I'm sure that you heard a bit of these myths around stem cells. So, what are the biggest myths you hear, and how you can set the record straight?
Yeah, one of the biggest myths is that it's illegal in the US, and that's just really silly. It's
Mhm.
interesting the myth persists, probably because some people will benefit from this myth. If you think it's not legal in the US, you're gonna do all you can to fly out anywhere else and get the treatment. So it's in a gray area. The FDA says you can provide cell therapy, you can provide tissue transplantation therapies, because traditionally, if you're transplanting cells from one person to another, whether or not the person is an adult or from a newborn, the umbilical cord, right, it's still from one person to another, is in the realm of tissue transplant, not the realm of medication treatment. And so the FDA's role is to regulate the production, distribution of medications, right, to make sure it's safe and effective. So the tissue transplant doesn't fall under the purview of the FDA because it traditionally is basically regulated by the medical community, the governing body for how medicine is practiced. So each state medical board are the ones responsible for regulating how medical practice is done. Just like tissue transplant, right? Organ transplant. The FDA is not going to say we approve liver transplantation. We tell you liver transplant is legal. You're going to find nowhere it's going to say liver transplant is legal. So is it illegal? No, it is legal. It's just regulated by the medical community, medical governing bodies, the state regulations. And there is a body, regulatory body called the American Association of Tissue Banks. So they are setting standards, issuing registrations, etc., to all the tissue banks that are collecting the tissue. And there are certain standards. You have to screen for certain infectious diseases, and there are certain sterility standards. So that's what the regulation is at, not the FDA. However, the FDA came in saying, well, if you do not manipulate the cells, so you don't multiply them, you don't use enzymes and chemicals, and if you do not use the cells in a way that's different from how the cells were functioning in the body before. So if it's similar, it's equivalent, if the cells were in the fat and you get the stem cells from the fat, then if you put it back into the fat, that's completely fine. That's called homologous use. So that's their rationale. And they said, well,
Mhm.
if you claim your product, you can either claim your stem cell product to be this type, which is under section 361, which means the cells are a tissue transplant product, is not a drug. But if you change the cells in any way, if you talk about using the cells in a systemic way, or talking about your benefit as being a result of the metabolic activity of the cells, now somehow they think it's a drug. So go figure. I want listeners to hear. You know, let me know your thoughts. Do you think that makes sense? The moment you talk about that you're using the cells because you are utilizing their metabolic activity because the cells are alive, that means it's a drug. So tell me if you think it makes any sense. But that's what they say, right? So then if you are a tissue bank and you're selling the products under this tissue transplant sector, section 361, the FDA comes to you and they say, well, the cells, obviously you talked about the cells being having metabolic activity, and that could be a result of how it could be helpful for people. If you ever mention anything like that, or if you use a cell in an intravenous manner, and then they think now it's a drug. So now you have to go through drug studies. Now you better stop selling your product. So you cannot
Wow.
sell your product while you're under study, right? You pay millions and millions and millions of dollars. And not only just that, but time and energy, and they may not approve it, right? So they may approve it, and you may start. You pay a lot, large amount. You got a permission to do studies, and in the meantime, you can't sell your products anymore. So you have to do the studies, and when you do this as studies, they could shut it, basically saying, well, we don't like this part, we don't like that part. So you could drag on and on and on. So I've heard multiple tissue banks going bankrupt. They ran out of money. It's over. So that's kind of the state of where it's at, right? From the regulatory point of view, it's not friendly. From large corporations for social media, Google, Facebook, Instagram, they are also not friendly. So how are we still growing like wildfire, right? So that just shows you the power of the cells. You cannot stop the power of these cells because this is ordained. Going like a whole different direction. This is coming from a place of healing. I think there is a spiritual component to this. People are seeking healing. People are sick of the conventional methods that are not getting them well. So if they can find something where they can feel good and can thrive or cannot die, they will find it. So that's the life force. You're going to seek solutions. You're not going to stop that life force within all of us. Anyhow, so that's the biggest myth, that the companies overseas. Okay, why do companies go overseas? Because they're able to expand the cells, which means putting the cells in a tissue culture and an incubator to allow the cells to grow and make huge numbers of them. There's a lot of problems associated with that because when you grow cells in multiple generations, they start to change, they start to lose potency, they start to express surface markers that will mark them as a different individual, and that can trigger rejection type of reactions. And they can also secrete inflammatory molecules, and that is going to be triggering different kinds of reactions to the body. Tony Robbins call it cytokine storm. I think the cytokine storm that he is telling everybody you're going to get with stem cell therapy, of course he got it overseas, is a result of inflammatory molecules that are secreted, that's produced during the expansion process, and the surface marker emergence that's causing rejection. So, but these clinics, the reason they're using expanded cells is because traditionally in medical research, they started expanding the cells, and they give animals at a large dose, and then they translate that into humans. So animals, if you're using the usual dose is 1 to 2 million per kilo. So they're translating that the exact amount to humans. So you think a human has to take, right, an average 70, whatever, 60, 70 kilo, that you think a person needs definitely, more than 60 million, probably should be more than 100 million. So now overseas, it's very common for people to get 100 to 300 million cells, and I think that's better. But what I see clinically, that's just not the case, because I give people 1/10 of that number, and we have just as good results, if not better. So, however, because these companies are holding on to the numbers from research, they and all the research are using expanded cells, so they think they have to give that high number, and then they're going to be required to do FDA studies, and they don't want to do that. So they go overseas, Panama, Costa Rica, Colombia, Mexico, right, Bahamas. So they are, they're avoiding all this regulatory scrutiny. However, in the US, when doctors can't do that and tissue banks cannot do that, they just give you what the extracted material was, right? Whatever they separated out from the tissue, usually, almost all of them mechanically, unless they break the rule and use collagenase. But when they just use mechanical forces, macerating the tissue and allow the cells to be freed up, and then they'll get the cells, they don't do anything to it, they freeze it, and then they're ready to sell to doctors. And because in the US we are under that kind of limitation, but then we're still seeing incredible results. So the whole group of the doctors in the US are using these products and are seeing incredible benefits. And in my clinic, the same thing. I have my own special formulation because I've used different types of stem cell products. They're all useful. You can use umbilical cord blood stem cells, or cord tissue stem cells, or amniotic membrane stem cells. Everything is helpful, but but nothing is good for everything because they all have different properties. So our product that I developed, actually, I started a stem cell company because I was really tired of how people were in the industry, the way they practice business practices. It's very much oriented toward money. And I think science and healing should always come first. Money will always come when you provide value to the world, but you need to get your priorities straight. So I was just tired of it. So I started my own company. And so that's the product we have, Chara Biologics. So yeah, because we are using these unexpanded cells, we're not seeing much side effects, rarely any, and we're seeing just as good results. Um, so you're reducing side effects and preserving or maybe even enhancing benefits. So I believe what we have in the US, of course, depending on what company's product you're using, the product is a big part of the stem cell therapy. If your cells are not the best kind of cells, then you're not going to get the best results. But I think the United States is doing an incredible job for Americans, yeah, which is very, very lucky because they don't have that in Canada. And they don't
No,
have that in Europe, and they're
no,
very strict. So
very
definitely not
strict.
Australia, where people fly
Unfortunately,
from all over the world to
we
come to America.
have we have Health Canada here, and we're very, very difficult, limited, and restricted.
And
So, for someone who has never considered stem cell therapy, so what are some situations or symptoms it may worth or where may worth to explore stem cell therapy? The situation or symptoms.
what may be the symptoms that's worth exploring? Symptoms. Well, just about okay. If you are looking at symptoms, whatever the symptom is, if it has something to do with inflammation and tissue injury,
Mm-hmm.
it's it dovetails to what stem cells do because the most important tissue injury, inflammation, and also immune dysregulation. So these are the
Mm-hmm.
three big categories. Almost all chronic illnesses have inflammation as part of the underlying problem, right? Even osteoarthritis, there's inflammation. There's inflammation throughout the body. That's why you're not keeping up your repair in the local area. So inflammation is a huge part of modern disease. And then tissue injury, of course, the tissue injury is what is producing local issues, whether or not it's heart problems or joint issues. And then the immune dysregulation, of course, we're all experiencing immune senescence. So our immune system get older, gets less effective, we get sicker easier. That's why the age is most correlated factor with cancer, right? The immune system not keeping up with fighting off the cancer. So now the cancer can thrive. So the immune senescence is a huge part of aging. Stem cells can boost the immune system when it's needed, when the immune system is weakened. It can calm the immune system when the immune system is overactive, causing autoimmune diseases. So these are the three big categories. So anyone having any of those. But of course, the research have shown, like in my training this weekend, we went over about 30 different organ systems, whether or not is skin or eyes, ears, heart, liver, lungs, reproductive system, neurological issues. So every type of broad category, we're going over different evidence, different research studies. So yeah, there are rare diseases that have not been studied, but most of the major disease categories have been studied, and there's been a lot of positive studies.
And
Yeah.
is there any place for women going through midlife, perimenopause, and menopause, stem cell therapy, supporting, considering their hormonal changes, anti-inflammatory effects, or something deeper? Is there any place for stem cell therapy?
Yeah, definitely. I mean, I'm 54 and I'm still menstruating. So the thing is, when you are using stem cells, for example, reproductive system, they have found in animal studies, interestingly, they were studying perimenopausal rats. I didn't even know that rats are running around menstruating, but there are perimenopausal rats. And what they did is that they give them stem cell infusion, through the vein in the tail. So that's, that's their form of infusion. And compared to the rats that do not get the stem cells, their ovary size increased, the follicle number increased, the estrogen progesterone levels improved, right, going up, FSLH went down, and they had more pregnancies. So that's pretty resounding, right? When you get stem cells from young rats, all of a sudden, you're rejuvenated, including your reproductive system. Have I seen that in my clinic? Yes, we have actually one doctor working in my clinic. She's looking at fertility. She really wants to have a baby, and her AMH, which is a marker for fertility, went up sharply after a stem cell treatment. And another also doctor patient who really wanted to have a baby but kept having miscarriages for 4 years. And then after one stem cell treatment, within 2 months, she's pregnant, and now her baby's already a year and a half old. Yeah, so yeah, these are, it's just okay. Fairly
It
good evidence.
sounds promising. I mean, it
Hmm.
sounds great.
Yeah. So that's reproductive, but it
Yes.
does,
So,
yeah.
what is the any difference between the more aesthetic stem cell therapy for skin and hair versus systemic immunity,
Yeah.
brain fog? Any difference or joints?
I think everything can be, if something is good for your overall system, it's going to be good for your skin. So I can show you pictures of me when I was 45, and how I look a lot younger than when I was at that time. And my focus is IV stem cell therapy. And of
Mhm.
course, I have my own skin cream that is very helpful as well. And once in a while, I do a kind of a laser. Uh, at our clinic, Photona, which is really nice for skin regeneration. But overall, even before I've ever touched the laser treatment or even had my cream, my face, my skin was regenerating. I was looking younger and younger. So I think when you approach things through the IV route, you are addressing the entire body, including nourishing everything under the skin. Right? That'll be the fat, the bone, the ligaments and the muscles, and all the layers, and your skin layer. Everything is nourished and rejuvenated. Just like when they were conducting therapy, experiments on animals, on mice, these middle-aged mice, when they started to give them regular IV stem cells, and compared to mice that did not receive stem cells, their fur was shiny and even, right? So that's their skin.
Mhm.
They were showing that they look younger. Their spine is straighter, they're running better, and their cognition's better. So overall rejuvenation from the inside out.
Amazing. And do you combine stem cell therapy with other therapies like IV nutritions and hormone therapy, PRP, or peptides in your
Yeah,
practice?
so at our clinic, we definitely, we're very, very integrative. That's why my academy is called American Academy of Integrative Cell Therapy. That was very important, to respect the complexity of the human health, because we're not just, just the cells. That's great, but you still need magnesium, right? You need zinc, you need
Mhm.
amino acids, you need good lipids, and you need light. You even, mental, your thoughts, everything plays into it. So at our clinic, we have nutritional therapy as part of the treatment. So everyone's supposed to take certain supplements that we know can enhance the functioning of the cells and helping the body detox and give you the building blocks to make new cells, make new tissue. And then we use ozone therapy to help cleanse the blood, activate the antioxidant system, right? Superoxygenate the body, allow the red blood cells to be more flexible. We utilize hydrogen water, which is very, very highly beneficial as a fundamental factor for cellular health. And then we use a light bed that has different light frequencies and also just different quantum frequencies to help the body repair. So we have a patient drink a hydrogen water, get into the light bed, get an ozone therapy, and then when we do the treatment, we also utilize peptides. We also use another form of laser light that we can direct the cells to places. And I say we really want to focus on the brain. We have laser light that can focus specifically on an organ or the knee or the heart. So the laser light can help direct the cells to a location. I'm not going to go ahead and try to inject somebody's heart. And first of all, I'm not a cardiologist, but second of all, you can also cause damage, and it's not necessary. Light energy is a much more elegant way of getting the cells to a place. So come to the modern age, right? We're in the 21st century. You don't have to jab a person in order to produce an effect. So we're moving on in medicine. So that's what I'm trying to let people know, that we have tools that we don't have to cause damage when we're trying to produce benefit. So and then we can also utilize sound therapy. We have an incredible shockwave machine. There's just various tools that we incorporate.
It's amazing. So now you're talking about these treatments. So for someone who never had stem cell therapy, how is this therapy? Is it invasive? Is it painful? Is it a one-off thing, or they need maintenance? How does it normally work?
It is depending on what kind of condition we're trying to treat.
Mm-hmm.
So for chronic issues, usually we recommend a few sessions, about 3 sessions spaced 1 to 2 months apart. However, it doesn't mean that with one session, some people are not going to see incredible results and then they don't need a second one. We've seen that also periodically, but that's not something that I expect for everybody. I don't want people to think that we're performing miracles here. We're performing a medical treatment that takes particular dose, a frequency, and that's what medical treatment is composed of, right? You need a protocol and regimen. So that in general, for chronic conditions, that we have 3 sessions spaced 1 to 2 months apart. And of course, if just an IV infusion, whatever pain that happens with an IV, right? You can people establish an IV access in the arm. That little poke. So that's about it. Then you don't feel anything anymore. So that's IV injections. We'll inject into joints throughout the body. So we can inject into the knees, shoulders, hips, or the back, or other, smaller joints as well. But a lot of the very small joints, we don't really need to inject locally because the little joints are so well perfused by the blood supply. So when you put the cells into the IV route, then it goes everywhere. And also we can inject into the penis, vagina. We can do facial, right? We can put the cells into under your skin, and we can do hair restoration. So those, could be a little painful. It's better not to use anesthetics because anesthetics are in general harmful, a little bit harmful for the cells. If the patient is in a lot of pain, we can certainly use anesthetics, but it will reduce the efficacy a little bit, but it's going to work well. But we want to amplify, right? Maximize whatever the best we can. So, but it's a little bit painful, but it's tolerable. The hair also. So the hair restoration and the facial rejuvenation. That will probably be the most painful part. The joint injection, not very painful.
So there are some concerns about safety and the sourcing of stem cells. How can people find, or they know that they're getting the right, effective, and the safe stem cell therapy? What are the things that they have to look for when they're researching?
That's my mission. It's not easy because you need to understand what
Mm-hmm.
the cells are, the tissue banks, and how are they making the cells? Who are the donors? How are you processing it? Are you having all the right protocols for sterile process? Because all these tissue banks have gotten warning letters from the FDA, because when the FDA actually go to the manufacturing facility to inspect, a lot of them do not meet criteria. A lot of them have practices that are just they're not paying that much attention. They're not adhering to enough of the sterile techniques. It's just crazy. You would think everyone is going to do the right thing, but there's all the major tissue banks have pretty much have gotten warning letters because of the not meeting the criteria for good practice. So how do you know, right? That's where I come in. I'm the gatekeeper to help finding the right products. And any manufacturer I work with, I personally go there and inspect their facility, understanding what their process is. And of course, I mount my own formulation. They have to produce the way that I design, and is not a just off the shelf. You just extract cells from one part of the cord, and that's it. You give it to people, and which is 99% of the tissue banks what they do. So my product is very, very special because I am designing to get cells from different portions of the cord tissue of the umbilical cord, and that is a much more labor intensive process. So it takes a lot more effort to make, and no one is really making it because they're not thinking the way I'm thinking, that you need the combination of these different segments. So yeah, so we have the highest range of capabilities because we're getting cells from different compartments, and also high number of cells because we're getting cells from all these compartments. So then we get more cells. So more cells and higher potency and more range of capabilities. Yeah, so people have to do their own research, to see if
And
the
so for
kind of
the
stuff.
viewers here, they can maybe contact you to talk and take advice or come and visit you maybe.
Yeah. So if people really want to reach out to me, probably one easy place is just Instagram, right here at
Mhm.
Dr_Joy_Kong. That's Kong. So they can reach out to me. They can also email us at info at drjoykong.com if someone wants to reach out and ask questions. Yeah, or you can ask your doctor, are you using Chara Biologics products?
Mhm.
The main stem cell product is called Chara Core. So that's CHARA, Core, CORE, and that's the product that I firmly stand behind and I absolutely love. And I see it every day in what it does for patients.
Mhm. And what's the difference between stem cell from yourself versus donated? So is there something like that?
Yeah,
Uh,
the stem cells.
act-
I did that extensive study. Anybody who's interested in the difference, it's a 40-minute lecture. So I'll give you the gist of it. But if you go to YouTube, it's called "Are All MSCs Created Equal?" And you will take the whole journey with me because that was my question. Should I
Mhm.
try to learn how to do stem cell therapy, taking the cells from a person's own, or should I learn it maybe from the umbilical cord because that's the youngest source? Which route should I go? And that's how I started reading articles and articles, and because I wanted to see has the world tried to learn and study the differences. And there are studies directly comparing the,
Mhm.
the growth factor profile of the cells, the telomere length, how long the cells can survive, how many generations they have left, and how flexible they are as far as differentiating, right, becoming more specialized. In every factor they looked at, it's very conclusive. The umbilical cord cells is better than a person's own cells. The major categories is getting cells from your own fat or from your bone marrow. So they compared umbilical cord cells with fat-derived stem cells and bone marrow-derived stem cells, because fat and bone would be from a person, from an adult person, right? So in every aspect, the umbilical cord cells are superior. So that's
Very
I'm
interesting.
if something is superior, then I'm going to give that to patients. And it's not just that it's superior in its potency, it's also safer because your own cells, there's been much more reports of exacerbating cancer. And for umbilical cord cells, there has been no reports that it can exacerbate cancer because the cells are so young, it's able to recognize cancer
Mhm.
when it sees it. But when our cells are getting older, is losing capabilities. So it's unfortunate because direct comparisons show that fat-derived stem cells make the cancer grow, and umbilical cord-derived stem cells make the cancer shrink and go away. So, from an ethical standpoint, I'm going to give people the kind of cells that's going to give them the least problems and concerns, right? Least potential problem of damages. So yeah, so it works better and has less chance of promoting cancer.
Great. Amazing to know. For our listeners, what's the last and most important message about aging process and future regenerative medicine?
Yeah, I think in the future, I tell people that stem cells is going to be no big deal. I mean, right now it's fancy. Oh, so people think, oh, only if I'm rich I can get stem cell treatment. Frankly, it's pretty accessible. I know it does cost money, but considering what it can bring to you and really considering where the cost could be, this is actually very accessible. If anyone's interested in knowing what pharmaceutical companies charge, just watch Unnatural Selection. I think it's a Netflix documentary. It's about gene
Mm.
therapy. And when Big Pharma gets involved, they're charging $750,000 for one gene therapy session, right? That's one vial that they put in your body. That's 750,000. So I mean, that's real, right? That's not accessible. But between $5,000 to $25,000, that is accessible for a lot of people. And I think, but still, it's still not cheap. The field is still changing. It's getting more and more popular. The price will go down, and one day it's going to be just. I'm hoping everybody can afford it, and everybody will be doing it to prevent disease, to or to heal from anything that happens to them, any injury, any severe illness, or an infection. They're going to use stem cells to heal so much faster and so much better. Or post surgery, post surgery, they can use that. So your surgery can go so much better. You will heal way faster, less downtime. People are already doing that right now, but in the future, it's just going to be commonplace. Just like they have prophylactic antibiotics when you do surgery, right? The doctor gave you some antibiotics. Instead, the doctor would just give you some stem cells, and you will have much less chance of infection, much better capability of repairing the wound site when the surgeons cut. So that's all coming. It's just going to be commonplace. It's going to be part of the language of modern medicine. That get some stem cells.
One last question. Someone is just dropping here about stem cell therapy. Is it reversing age, or is it slowing down age and improve function? Which of these?
It can reverse age. Yeah, yeah, and I have studies to prove it. There are animal studies. First of all, it extends the lifespan of animals by about 30% when you give regular IV treatment for middle-aged animals. And when they dissected the animals, so not only do they live longer, of course, I mentioned they look better, they're moving better, their brain functions better, but when they dissected their brain and their muscles, they were trying to track to see the acetylcholine signaling system, neurotransmitter profile, and then look at the cellular markers, whether or not it's senescent markers. The older the cells are, the higher the senescent markers, right? And then the lower certain growth factors are, and then they also have more toxic waste built up, certain markers. And so everything they looked at, whether or not with age it should be going up, and it was reversed. With age it should go down, it was reversed. So everything that you're looking at, the cells are literally reversed to a younger state. So it's reversing aging.
Amazing. Amazing.
It is.
It's great. It's great time to practice medicine and know more and more about stem cells.
Yeah, yeah. I'm here spreading the word because the humans, us, we need healing. We need to be more vibrant. And when we're
Absolutely.
healthier, we're also kinder to each other. The world's
Mhm.
going to be a better place. If we're sick, we're grumpy, we're not treating each other nicely. This is all part, the physical health is really important as well. I mean, I was actually trained psychiatrist, so mental health is really important. But everything is important. So you want to help your physical health. And we know that stem cells can reverse aging and it can reduce your biological age. Actually, I talked with some biological age testing companies. We have seen evidence that it reduces biological age.
Mhm.
So we know if you reduce biological age by 7 years, if everybody just reduced, let's say, someone's 47 and now it's 42. If everybody across the board reduced biological age by 7 years, half of the world's chronic illness is gone. That's how powerful this treatment can be. And I think reducing by 7 years is easy. I think we can reduce by 15. Yeah, and just imagine if 3/4 of the world's illness is gone.
Wow.
That's a beautiful vision, right?
It
Yeah.
is. It is amazing. It's great talking to you, Dr. Joy, today. Amazing talk. And definitely, we want to repeat this and know more and more.
Yes, absolutely. This stem cell therapy is going to thrive no matter what, no matter who says what.
That's true. Exactly.
Yes.
We will move on. That's great. Amazing to have you here today. And thank you, everyone, for staying with us today. And see you all soon. Have a lovely, lovely day, Wednesday.
Yes. Thank you, everybody, for
Thank you.
listening. I hope you are inspired. Okay. Yeah.
Definitely. Definitely. Bye bye. Take care.
Bye.